So PCS coding, guys, is about procedure coding. There are two books actually. The other book is also for procedure coding, but the PCS book, guys, it is the book that you guys use in the inpatient setting. What I mean by that is the patient is admitted in the hospital, and if you're an inpatient coder, the hospital uses this for a specific reimbursement model. And that reimbursement model, which I'd like you to really understand, guys, and remember, is called IPPS. Okay? IPPS. And IPPS stands for Inpatient Prospective, okay, Payment System. That's what IPPS is about. Inpatient Prospective Payment System. And for us to be able to okay, there's said, okay, the inpatient prospective payment system, guys, this is a particular payment model or reimbursement model that hospitals use, which means that contrary to many people idea of how hospitals get paid, it's not actually if I am to ask you, do you have any idea how hospitals are paid when a patient, gets admitted? You probably don't know yet what how this reimbursement model works. But what I'm trying to tell you guys is that the IPPS, or the patient payment system, is a kind of reimbursement model where a hospital is paid by according to a case, or it's a case-based type of payment, which means that if someone gets hospitalized, um, there is what is called the DRG system, or diagnostic related group, in which the patient's nature of admission is grouped into one category or specific category, and that category had already been, say for example, a patient was admitted for hip replacement. That hip replacement, there is already a set price or a set cost that a hospital um, is expected to spend. And because of that, there is already a prospective payment that has already been assigned to that case. That's what IPPS, or diagnostic related group. And I'm going to talk about the more of that, guys, when we get to the reimbursement model. But what I'm trying to tell you guys is that in this particular payment or reimbursement model, this is the procedure book we are using. Okay, the PCS. PCS stands for Procedural Coding System, and procedural coding system, guys, is only used here in the United States. Okay, there is nothing, it's not used in any other country, but here only in the United States. Okay, please remember that. Now, how is this book actually being used? Okay, let's go to the slides that I prepared for you guys tonight. Okay, ICD-10, which is procedural coding system. Let's read. The procedural coding system is used exclusively for inpatient hospital admission. Its main purpose is to document and code all procedures performed for the inpatient prospective payment system, which I have just explained to you guys, to help determine the hospital reimbursement. So what that means, guys, is that hospitals are not paid per diagnosis or per procedure. That's what I'm trying to tell you guys. Hospitals are paid according to the case they admit. If a hospital had admitted a patient with having a joint replacement, they have already figured out. Sometime in, I think, in the early 1980s, they have already figured out how much a joint replacement would cost the hospital. Cost the hospital for paying the doctor, nursing hours, the resources, the materials, all equipment, the operating room. They have already figured out how much a hospital would spend for those. And because of that, they have assigned enough margin for a hospital to make some profit. That's how this inpatient prospective payment system works. Okay, so again, guys, depending on how a coder assigned the codes, they will determine what the type of procedure this is. Like for example, if a patient had again joint replacement and the coder assigned a code for, instead of hip replacement, the coder assigned a code for knee replacement or shoulder replacement. So the reimbursement is going to get affected, right? Because the hip bone is bigger than a shoulder bone or the knee bone, right? So what I'm trying to say is that there has to be, coders need to be accurate in assigning the code for procedures, because it really depends on how the patient's case is assigned to a specific category for to maximize the reimbursement. So codes are really, really important. Now, how are we going to use this book? Okay, so um, it's very different from, of course, very different from the first book that you guys have used, because this book actually, guys, the PCS coding system, there is no set code that you see as, in the procedure code. Like procedure code, if I say, the diagnosis code, if you look for the code for hypertension, there is already a code, right? I-10. The procedure coding system right here, guys, you actually, as coder, you build the codes. Okay, interesting, right? You build the codes according to what has been done, okay? According to the characteristic of the procedure. And I will explain to you guys how that works. Okay, so says here, okay, the general PCS code format, okay, let's read this. ICD-10-PCS codes are composed of how many characters? 7 characters. Each character is an axis of classification that specifies information about the procedure performed. Okay, so I'm gonna show you on the board, guys, what these different axes are. Let's continue. One of the 34 possible values can be assigned to each axis of classification in the 7-character code. They are the numbers 0 through 9 and the alphabet except I and O, because they are easily confused with the numbers 1 and 0. The number of unique values used in the axis of classification differs as needed. Okay, let's stop from here for a little bit, guys, and I will show you on the board what these 7 characters actually mean and what do they represent. Okay, matter of fact, these 7 characters, if I move on to the next slide, are these, okay? It's the same thing if I'm going to show you on the board, but let me explain each axis here. Axis 1, 2, 3, 4, 5, 6, 7, which means that this represent the 7 characters of a PCS code. Okay, the first axis right here is the nature or character of the procedure. What do I mean by that? So it is already established that a procedure code, guys, has 7 characters, okay? Let me draw this illustration on the board, and let's have a thorough discussion about this 7 character. Okay, so you have 1, 2, 3, 4, 5, 6, 7. So let's not pretend, I mean, let's assume that these are your different axes, okay? Okay, so these are different axes, like this one right here, okay? Axis 1, 2, 3, 4, 5, 6, 7. Okay, now the first one, which you guys seen on the on my slide, says it is the section, right? Section. Now, what is a section? Section, guys, basically is how do I say it? Section is the nature or the character of the procedure, which I mean that if a patient comes in for hip replacement, again, that same example that I used earlier, the nature of the procedure is surgical, right? It is surgical. If a patient comes in for, say, treatment for infusion of like a blood transfusion, what is the character of the procedure? It's actually administration of a substance, right? Administration of whatever that being infused to the to the patient. So that's what I mean about the section or surgical or medical, right? If a patient comes in or admitted for delivery, it is obstetric in nature. So section, the first axis here is about a section explaining what is the nature of the procedure that's going to be performed. Okay? Most of the time, guys, maybe 90-95% of the time, the, the procedure is always surgical or medical in nature. Most of them, right? Like 90% of the time. If a patient gets admitted and had like, for example, had a biopsy procedure, a lung biopsy, that's surgical, right? Every time an incision is created, a scalpel, any cutting instrument is used for the patient, that is surgical in nature. All right. If a patient, comes in with heart failure and they perform like say they perform a procedure to treat that heart failure without without performing an operation that is medical in nature. Okay. If a patient say um, again, delivered a baby, right? That is obstetric in nature. So the section guys will explain to you or will show you what kind of a procedure it is. What is the nature of the procedure? That's your section. So that is axis number one. Okay. Number two axis, look here, guys. The number two axis here is the body system. What do I mean by body system? Body system is, of course, it talks about the system where the procedure was performed on. Say, hip replacement again. What is the body system that the hip is under with? Okay, so the body system that the joint is categorized within is, of course, musculoskeletal system, right? It is the lower or the upper joint. So that's the body system. If the procedure is about removing an organ, like removing or say surgically removing a part of the lung, resection of the lung, what is the body system? It is respiratory system. So number two axis, guys, will tell you, and if you're building the code, if the patient is having a respiratory failure, and because the lung is has say a fibrosis, and the doctor decided, okay, we're going to remove part of the lung, that's actually respiratory system. Okay, if a patient having a heart failure, what body system it is? It is circulatory or cardiovascular. So the number two axis, guys, will tell you when you assign a value to number two axis or the second axis, it tells the next user of the chart that this is a body system pertaining to where that organ, the organ was performed on. Okay, so number two is body system. Okay, so yeah, that's your number two axis. Look, the third axis is root operation. Okay, let's read what root operation is. The main objective of the procedure, determining its final intent or purpose. which means that if removing without replacing an entire organ, the root operation is resection. Okay. If the objective of the procedure is only to excise a small tissue, only to remove a small tissue, it is what we call root operation excision. Now let me explain what root operation, the third axis, means. Okay, when it says root operation, guys, it talks about the final purpose of the procedure. What I mean by that is that any procedure, of course, there are what we call when a surgeon performs a procedure, there are several steps, right? From preparing the patient, prepping the patient for, for the operation. The patient needs to be, of course, say needs to be sedated, right? The patient needs to make sure that the patient is ready for the operation. There are few necessary steps to be performed before the main procedure. So an example would be, because when you talk about root operation, guys, there are many of them. Matter of fact, if you go open the book, let's open the book and let's look for the root operation. Where is that root operation table is? Okay, let me look at it. Okay. Page 843. Can you guys please open your book? By the way, for those that just joined in, we are talking about this book right here, okay? ICD-10-PCS. I am explaining to you guys how to use this book. Okay, so please grab this, and we're going to look for page 843. Everybody, please go to that page 843, and I will show you guys what these root operations are. Matter of fact, it started with 838. 838, not 843. Everybody, please go to 838. That's your root operation, 838. Okay? You guys there yet? Everybody found it? Okay, so the root operation, guys, there are many of them, right? The first one is alteration. What is alteration? Based on the definition here in the book, it says modifying the anatomic structure of a body part without affecting the functional of the body part, which means that the doctor perform a procedure to modify a specific organ, right? Without really impacting or affecting the function of the organ. A good example would be breast augmentation, right? A lot of people, women would want that, or would prefer to have, like, we go breast augmentation or breast implant, and that is an example of alteration. Again, for example, would OSR 901A be valid code for hip replacement? I don't have the code at the top of my head, because there are many ways to perform to code a hip replacement again, but it looks like a procedure code, right? But what I'm trying to say is that when you're assigning a code, you have to determine what the root operation is, because that's a good place to start. Okay, so I'm gonna check that code later again. But what I'm trying to say, guys, if you talk about root operation, again, this is the final intent, the final purpose of the procedure, and every coder needs to be able to determine what specifically a root operation. If you guys go to root operation insertion, go to insertion, letter H, okay, page 839. The value for root operation is H. Let's read insertion, guys. Insertion means putting in a non-biological appliance that monitors, assists, performs, or prevents a physiological function but does not physically take the place of a body part. Okay, so now why am I saying this, guys? Why am I explaining to you the insertion? If you look at the definition of insertion, meaning it is a doctor, a surgeon has put in a device, right? Inserted a device into the patient's system. Okay, it can be a non-biological appliance that monitor, assists, or performs a physiological function. Okay, but not physically take the place of a body part. A good example would be a pacemaker, right? A pacemaker is inserted into the thoracic region, like the chest area, in order to monitor the rhythm of the heart, right? That's how the pacemaker, the pace, the beats, the heartbeat. That's how the pacemaker is useful for, right? So that is insertion. Now, when right below insertion, guys, look at inspection. Okay, we're still in the root operation. Bear with me, guys, because I'm going to explain to you why that word final intent is really important. Okay, what about inspection? Inspection says visually and or manually exploring a body part. Okay, an example would be diagnostic arthroscopy, exploratory laparotomy. Okay, let's compare this insertion and inspection. And I told you guys earlier that a coder needs to understand, needs to determine what is the final intent of the procedure in order for you to decide what really is the root operation. Okay. When a doctor performs an endoscopic procedure, endoscopic procedure means this is exploratory. If a doctor needs to look at your stomach region, the doctor would most likely insert a scope into your oral cavity, right? Push it all the way down to your esophagus, and look at the abdominal region or stomach region, if there is something going on there. Usually, this type of procedure, guys, is for a patient who is having like maybe having some blood in their throw up, right? Or patient that has a chronic, chronic diarrhea, and the doctor wanted to see if there are some kind of a bacterial infection going on in the stomach. So the doctor would like to explore that. So the doctor would insert a scope all the way down to the stomach region. Now, let me ask you, was the purpose of the procedure is insertion, or was the purpose of the procedure is inspection? Because insertion was part of it, right? Inserting a scope. Now, if you are to ask what is the final intent of the procedure, was it insertion or was it inspection?
Inspection.
What was that? Inspection, right, Leanne? It was inspection, right? However, before the doctor uh, if the doctor wanted to be able to perform inspection, he needs to insert a scope. You guys see now where I'm coming from? So the root operation is not insertion, but the root operation is inspection. Does that make sense, guys? Another example. So let's say stay with that with that procedure. The doctor now, because he cannot really make or put a finger on what the patient is having, having a chronic diarrhea, having abdominal pain. So the doctor decided he's going to insert a scope, and at the same time, during the process, the doctor will collect a specimen, will collect a small sample tissue, right? Just a small sample tissue, in order to to send it to the pathology for a biopsy, because the patient is complaining about severe abdominal pain, having sometimes it's patient is vomiting blood. and the doctor suspects there could be some kind of a lesion or a tumor or something like that. So the doctor went in, inserted a scope with, say, with an instrument to collect that specimen. Now, let me ask you again, what was the intent of the procedure? Was it the insertion or was it the collection of or the excision of the small tissue? What do you think, guys? Was it the collection of the small tissue or was it the insertion of the instrument? I'm asking about the final intent of the procedure.
Collection.
The collection, right? Thank you, Leon. So the collection or the excision of the small tissue was the final intent of that procedure. It's not the insertion. And that's the reason why I brought you to this page of the book, because I want you to understand what I mean by the final intent. And that is the root operation. In order for you to be able to assign the appropriate, the most specific root operation is to understand what was the doctor trying to achieve. Okay? Do not code it, do not assign a code or assign a value for root operation when a doctor only uses, in order for the doctor to achieve it, okay, that the final intent, he needs to do some preliminary steps. Another example is if the doctor would like to perform a laparoscopic, a removal of an organ. Of course, the doctor needs to create incisions, right? So he needs to cut some, cut some part of the skin in order for the doctor to be able to insert an instrument. So the cutting of the skin is just part of the procedure. The final intent is the removal or the resection of that specific organ. So now I think you guys now have a better understanding of what a root operation is. So root operation, let me go back here, is the main objective of the procedure determining its final intent or purpose. Okay? Now, let's go to number 4. Number 4 here, a body part. I don't have to explain what a body part is. Everybody knows what a body part is, okay? If the doctor performs a exploratory, inspection of the stomach, of course, the body part is stomach. If the doctor performs hip replacement, the body part is the joint, the hip joint, right? If the doctor performs a resection of the lung, body part is the lung. So I don't have to explain to you what the body part is. But in our discussion of the guidelines, we'll talk about more how to qualify a body part. What about number 5 axis here? So far we have already talked about axis number 1, which is section. Axis 2 is body system. The third character is root operation. Fourth character is body part. And the fifth character is approach. Okay, and what is the approach? Okay, so an approach, guys, is, let me read. How did I explain what approach is? Approach is the manner of which the procedure was performed or the type of surgical or non-surgical opening created or navigated to gain access to the organ or body part. Okay, so how I put in the explanation here, guys, is that an approach can mean many different ways, okay? An approach is the manner how the procedure or how the doctor gained access to the organ, okay? Example, again, let's use that endoscopic procedure exploring the stomach, okay? If the doctor inserted a scope into the oral cavity and pushed all the way down to the stomach, what approach is that? The approach is endoscopic, okay? Endoscopic via natural opening. That's what approach is. Okay, so there are many approaches. The most common one, the most common approach, of course, if the procedure is surgical in nature, is an open approach. Open approach means the doctor created enough or big enough incision in order for the doctor to gain access to the organ. Example, an open heart surgery. An open heart surgery, guys, the doctor needs to create a large enough incision in the thoracic region, right, in the chest, for the doctor to be able to perform that surgery, right? If it's a bypass, if it is like a stent placement via open procedure, open approach, then that's what I mean about approach. Okay, so there are two approaches already that we talked about, right? The endoscopic, where a scope is inserted into a natural opening, right? Another approach, when the doctor says or the documentation explained that the doctor performed a procedure laparoscopically. Laparoscopically means the doctor only created small incisions in order for to insert the instrument and perform that whatever procedure that is, whether it's excision, whether it is a biopsy, whether it is removal of the organ. Okay, so laparoscopic means it's not an open approach, but it is percutaneous endoscopic. What I mean by percutaneous endoscopic is that every time you hear the word percutaneous, guys, it talks about a procedure or an approach where the doctor only created a small incision. A very common example of percutaneous approach is when you go to the lab to have a blood work, right? It's a venipuncture. So medtechs, you guys know this, right? So you go to the lab, have your have some blood testing. You wanna find out how the level of your sugar level, your creatinine, your CBC. So a phlebotomist will perform a venipuncture, right? So venipuncture, guys, is percutaneous, meaning uh, by using a small needle to create an incision, the phlebotomist will gain access to your vein, right? So that's one type of approach, percutaneous. Now going back to laparoscopic, this is percutaneous endoscopic because when you talk about laparoscopy or laparoscopic procedure, guys, there is always a scope or a camera that will be inserted into the opening, so the doctor will have a better a good view of the inside of the body. That's what laparoscopic means. So it is percutaneous in the sense that there are small incisions. Laparoscopic meaning there is the procedure was done with the aid of a scope. Does that make sense, guys? So that's what I mean by another approach, percutaneous endoscopic. And another common procedure is approach is external. External means the doctor did not did not need to create an incision. The doctor will be able to perform that procedure without inserting a scope, without without cutting a body part. And what is a good example? Delivery of a baby, right? By a natural, spontaneous delivery. The doctor does not need to, to insert a scope. It can be delivered manually. That's external. What else? If the patient has a fracture and the doctor put a splint, right, to stabilize the fracture, it is external. The doctor or the orthopedic specialist does not need to create an incision to put a splint. That external. Another example is tonsillectomy. If the doctor needs to go to remove a tonsil, he does not need to create an incision because by a patient opening his or her mouth, the doctor will gain access to the organ. So the approach is external. Okay? Does that make sense, guys? Does everybody understand now what is an approach? We're talking about the different axes. Okay? So third here, I forgot to continue writing here. The root operation is the third axis. Okay. Fourth here is number 4 is body part. Okay. Number 5 is the approach.